My name is Shameq Sayeed. I'm a GP working in Oxford most of the time, and then every now and again I'm up in Palestine working for the last 4 years in a long-running project for the last 10 years approximately, and it's what's referred to within MAP as a family medicine project. It started in 2010, initiated by family medicine specialists from Palestine who had a desire to bring the specialty to Palestine, and I got involved in about 2015. And over the last 4 or 5 years between then, they've been developing a family medicine specialty program for residents here in Palestine. And that's working towards what we in the UK would call general practice. So it's trying to provide this continuous coordinated care within the community at this, where people are clearly, rather than having to seek healthcare in the hospital setting or in secondary care. And that's the need for that was clearly felt. It's felt in most countries, all countries in the world. And in Palestine, many people are aware, of course, of the occupation, the burden of disease that introduces. But of course, in Palestine, like in every other country, there's that increasing burden of disease from non-communicable or chronic disease like heart attacks, cancer, stroke. And these, of course, are a major source of disease within the Palestinian population. And that's what primary care is best suited to address. So, over the last 10 years, we've been working with partners in the Ministry of Health, UNRWA, the UN, the WHO. MAP, of course, has been supporting this all the way through from 2010, and I think that kudos to MAP in supporting what actually is quite a long-running project, because unlike other projects where you can often see the benefit fairly soon, this, we hope the benefit will materialize, but it will be a much longer-term thing. And I've just been here for the last day or so, going back in a couple of days, and I'm focusing on a particular area within the family medicine project, which is beyond the development of the family medicine specialists with the doctors who will be providing or leading on the family medicine care. Family medicine is very much about the team approach, and what I've been working on, again with these colleagues that I mentioned previously, is on developing what we're calling a transitional training program to upskill, as regards skills and knowledge, all of those primary healthcare professionals, the nurses, the midwives, the radiographers, the physiotherapists who work in primary care, so that they too are equipped with the skills and knowledge of family medicine, so as to work with those family medicine specialists who have been completing their training now since 2014, 2015, and we hope for the longer term as well.